The next is risk management plan. So one more document which is submitted, that is known as a risk management plan. So it is known as risk management plan in US, and it is known as risk evaluation and mitigation strategies in European Union. Okay, so to succinctly describe how the risk of a product will be prevented. So risk, I had already told you that risk means what? Risk means the adverse drug reactions which are associated with the use of the product. To succinctly describe how the risk of a product will be prevented or minimized in patients, provide plans for studies and other activities to gain more knowledge about the safety and efficacy of the medicine, identify the risk factors for developing adverse reactions, and to explain how the effectiveness of risk minimization activities will be measured. Okay, so risk evaluation plan is nothing but in that also the detailed information about the investigational, like about the drug, is explained. Okay, and the main aim of this document is to organize, or like by this in this document, the marketing authorization holder, they submit their risk management plan, like how they will manage the risk which is associated with the use of the drug product, how the studies will be conducted. So like there are routine risk management activities, then additional risk management activities, and knowledge related to the risk can also be collected via pharmacovigilance activities, like the routine and additional pharmacovigilance activities. And what is the information? First of all, how the information will be collected related to the risk, and what will be the activities, or what will be the measures which are taken by the marketing authorization holder, which related to which is related to the minimization of the risk. Okay, so how the risk of a product that can be prevented or minimized in the patients, that is explained in the risk management plan. What is the plan? What are the activities which are done to gain more knowledge, or which are planned by the marketing authorization holder to gain more knowledge or to get more knowledge about the safety and efficacy of the medicines. Okay, so that is the main aim of risk management plan or risk evaluation and mitigation strategies. Now, so about the risk management plan, we will discuss in detail later. So now after that, what are the documents which are required after the drug enters in the market, when the drug enters in the market? So after that, what is the documentation procedure which is done? So first is the clinical studies are published in the form of posters, abstracts, manuscripts, patient information sheets on and informative websites. So once the study is completed, the researchers or the investigators, they are interested to publish the report, publish the articles in the form of posters, abstracts, manuscripts, patient information sheets, and also the information is available on the informative website. So as we have already discussed, that these abstracts, manuscripts, and the information which goes on the informative websites or on the website of the manufacturing company, that all is written by the medical writer. Then health technology assessment. So health technology assessment is a document which is written to understand the safety aspects of a drug performance. Like there are certain drug products which are manufactured using the technology, like for example the vaccines and all, they are manufactured by using the biotechnological process, in which we study about biotechnological process, in which we generally study about biotechnological process means they are manufactured by following the procedure of recombinant DNA technology. Okay, so to understand a particular safety aspects of the drug performance in certain patient population, and it is used by national health authorities to assess the affordability of new drugs, comparing their benefits against their cost and that of alternative treatments. Okay, then so now in this document, we generally, the regulatory affairs managers, they provide a comparative study of the alternative medicine and of the drug which is developed by using some health technology, like how, because when the drug is developed by using some technology, it is comparatively costly than the other alternative treatment procedures, or the medicines which are available. So we have to, in this document, it is the accessibility, the assess of the affordability of a new drugs, like whether that drug which is developed using the health technology is affordable or not. We compare their benefits against their cost, and what is the cost, or what are the whether the drug is beneficial or not with the other alternative treatments present. Okay. Then periodic benefit risk evaluation report or periodic safety update report. Okay. So a PBRER, that is a periodic safety evaluation report, periodic benefit risk evaluation report, and PSUR, it is the same report. It was known initially as PSUR. Now the name has been updated to PBRER. Okay, and it is described by ICH E2CR2 guidelines, which explains the reporting of drug safety experience worldwide annually. So this is an aggregate report which is submitted after the drug gets approval in the market, and this report is submitted generally annually for all the drugs, and this report is submitted throughout the life cycle of the drug product. Okay. So detailed explanation of PSUR we will be discussing in the coming slides. So now we will discuss first about the risk management plan. Okay, so risk management plan, as we have already discussed, that risk management plan details the safety profile of a medicine, the actions taken by the marketing authorization holder to characterize the safety profile during post-marketing pharmacovigilance activities, and the steps taken to prevent or reduce the risk which is associated with the medication for patients, or the risk minimization measures. So RMP is what? RMP, actually, it is a document which is submitted along with the marketing authorization application, which is MAA, and it is a safety, and in this RMP details about that how safe the drug is, and in case the risks or the adverse drug reactions which are associated with the use of the product. So in that case, what are the actions which are taken by the marketing authorization holder to minimize those risks? And to minimize those risks, there are certain risk minimization activities and pharmacovigilance activities which are planned by the marketing authorization holder, which they will conduct in that particular year to reduce the risk or to prevent the risk which is associated with the use of that medication in the patients, which is known as risk minimization activities. And also, what are the activities which they'll do to get more knowledge about the safety and efficacy of the drug. So those are known as the pharmacovigilance activities. So overall discussion of these activities which are planned by the marketing authorization holder, that is also presented in the risk management plan. So all new medication applications, including generic and national applications, must include an RMP, which is then reviewed by regulatory authorities before a medicine may be approved. So now all the medicine applications means all the drug applications, whether they are generic drugs or whether they are for under a particular brand, they should include an RMP. And this RMP is also reviewed by the regulatory authorities before the medicine will get the approval for marketing. When there is a worry about a risk impacting the benefit risk balance, regulatory authorities may also request an RMP for products that have already received the authorization but do not yet have one. So in case if any report which is reported to the regulatory authorities or any information which reach out to the regulatory authorities in which the regulatory authorities, they have a doubt that this particular adverse reaction or this particular incidence is impacting the risk benefit balance. So in that case, the regulatory authorities can also ask for the RMP for the products, those who have already received the authorization, but yet they do not have any RMP. Okay, what is the information which is included in an RMP? The safety profile of a medicine outlines the significant known and potential risk. So the safety profile, which is related to the use of the medicine, so it also outlines that what are the potential risks which are associated with the use of the drug, what are the adverse drug reactions which are associated with the use of the drug, whether they are serious, non-serious, whether they are potential or whether they are predicted, unpredicted. to predicted or anticipated, sorry, not predicted is not the right word, anticipated adverse drug reactions. So information of all these adverse drug reactions should be provided in the RMP, and by which the safety profile of a medicine can be built up further. Then plans for research and other initiatives or learn more about the medicine safety and effectiveness, that is the pharmacovigilance activities. So pharmacovigilance activities are the activities which are planned by the marketing authorization holder to get more knowledge about the medicine safety and about the effectiveness, and what are the methodologies which are involved in pharmacovigilance by which we get to know more about the medicine, its efficacy and its safety, that we will discuss in module number 8, which is related to pharmacovigilance. Then how patient risk will be reduced or prevented. So if we know that there are certain risks which are associated with the use of the product, or if such cases are already reported during the clinical trial process, so how these risks can be minimized. Suppose, for example, if during the clinical trial process or during the non-clinical studies, if it is known that the drug is having a teratogenic effect and drug will be harmful to the fetus if it is taken by a pregnant woman, then it can be printed on the label of the medicine that the drug is prohibited to be taken by a pregnant woman. So this is a measure which is taken by the marketing authorization holder to minimize the risk, because accidentally, if that drug, maybe if someone purchased that drug off prescription or over the counter, or if sometimes the practitioner or the doctor, if they forgot to mention, or if the patient doesn't tell that she is pregnant, or they are taking the medicine for a pregnant woman, so in that case it is mentioned on the label so that they can read the label and they can understand that this drug should not be taken by a pregnant woman, so that there will be no teratogenic effect on the fetus. Okay, so this is how the risk can be reduced or it can be prevented. Then evaluating the success of risk reduction strategies means also that how, and also it is mentioned that how the whatever the strategies which are planned by the marketing authorization holder, so how you can access or evaluate the success of the risk evaluation, or how the risk which is associated, so how that risk activities which are planned, so the success of these risk strategies can be evaluated, so that all information should be presented in a risk management plan. Okay, so throughout the case of drugs lifespan, RMPs are continuously updated as new information becomes available. Holders of marketing authorization must submit an updated RMP. Okay, so now throughout the drug lifespan or the life cycle of the drug, this RMP also it is updated annually and it is submitted to the regulatory authorities by the marketing authorization holder. So when this updated RMP is submitted to by the marketing authorization holder at the EMA, means in the European Union, European Union, the regulatory authority is European Medicinal Agency. MEB or another national responsible authority request. When MEB stands for Medicines Evaluation Board, which is also a department which comes under the EMA. So in case if EMA or MEB or any other responsible authority of the European regulatory agency, if they ask for the RMP, then the marketing authorization holder has to submit the updated RMP. Then if the RMP is changed, particularly as a result of fresh information that can significantly alter the benefit risk ratio, or when a critical pharmacovigilance or risk reduction milestone is accomplished. Okay, so in case if the RMP is changed, in case if there is any change in the risk minimization plan, or particularly as a result of any fresh information which is developed which can significantly alter the benefit risk ratio, or which is critical, or any information which comes up which alters the risk benefit ratio, or when any from the pharmacovigilance activities or any new risk reduction activities or risk reduction milestone is accomplished, so that needs to be updated in the RMP. So in that case, the updated RMP is submitted to the regulatory authorities. In rare circumstances, the authorities may also impose a deadline for submitting the subsequent RMP as a requirement for the marketing authorization if risk justifies it. So now in that case, if the authorities, they ask for the updated RMP, so they'll also provide the marketing authorization holder with a deadline. Okay, in that deadline only, like if they will provide the month of 60 days or like the time period of 30 days or 60 days, so within that 30 days or 60 days time, they have to submit the updated RMP to the regulatory authority. Then submitting the risk management plan. So put the following information in the header of the accompanying letter where appropriate or preferably in the following order to speed up the processing of submission. So now how these these documents of RMP is arranged. First, the name of all the products to which your letter pertains along with any accompanying RVG or European Union marketing authorization numbers for goods approved under the centralized method. So RVG is what? RVG is a Dutch license number which is provided to the drug products which are approved in Netherlands. Okay, so the marketing authorization holder, they have to submit the name of all the products for which they are submitting the RMP if the manufacturer is manufacturing the multiple products. And along with that, if any registration number is there like RVG, which is a Dutch license number, so that registration number is provided, or if there is a number which is given by the European Union marketing authorization, if they have got the numbers to the manufacturing units or to the medicinals which are approved by a centralized method. So along with that number, with the product, along with that number, the list is provided. Then any case number. So if any query which is raised up by the regulatory authority, so that query has a case number. So that case number should be specified that in against this case number, this particular RMP or the detailed plan is submitted. Then date of the letter to which you are replying, then the letter or the query when it is raised, when the marketing authorization holder, they have got the letter, so that date should be written. Then the procedure type. So what is the procedure which is being followed, like whether it is a national process or whether it is an MRP. MRP is mutual recognition process, or it is a decentralized process, or it is a centralized process. So under which the drug is approved, like it is approved by a national process, or it is approved by a mutual recognition process, or it is approved by the decentralized or centralized process. So whatever is appropriate, that procedure type you have to write, and the particular procedure number, the related procedure number to that particular drug product, that should be provided. Okay, so this is how the documents can be arranged, and in this process only, if you submit all the details to the regulatory procedure, to the regulatory authorities, then the processing of submission will also speed up. After that, along with these information, you have to give the email address of the person whom the regulatory authorities can contact. The succinct summary of the letter subject, that what is the subject of the letters, like we used to write a cover letter along with the mail. So in that same way, the succinct summary of the letter subject, like what is the subject of the letter and all. So the succinct summary is provided. And if and when the RMP update has occurred, so like when if the RMP updation has been occurred, so then when the RMP update has been occurred, so that detail should also be provided. And if an update has occurred, provide a succinct summary of the changes made. So now if the RMP is being updated, then what is the changes which are made in the RMP? So that information also you have to provide. Then indicate that no update has been made since the date of the last update, if any. In case if there is no updation which is made since the last date of the update, after that there is no updation which is made. So you have to write that after the first updation or the previous updation, no update has been done since then. Okay. Then send the following along. So along with this information, the RMP after the modification, the RMP which is done, which is made after the modification, and along with the changes that can be tracked. So those the changes can also be marked so that it can be tracked by the regulatory authorities that where the changes are done. And then the RMP final version is attached along with the along with this information. Okay, understood? Is it clear? Okay, then the following information must also be included in the letter that goes with an electronic dossier. So now this document is submitted in hard copy as well as in soft copy. So the additional information which is required to be included in the letter, which goes with the electronic dossier, that is the number of CDs or DVDs which is contained in the dossier. So the number of CDs or DVDs which are there in the dossier. The statement that the information submitted online is identical to the documents. It corresponds to the, so there is a statement in the letter which indicates that the information which is submitted in the hard copy, that is same which is submitted here in the electronic submission. Then a statement indicating the contribution has been checked for viruses, including an up-to-date antivirus program. Okay. Then there should be a statement which indicates that the CDs or DVDs, they are not corrupt. They have been checked for the virus. There is no virus in that. And they have a updated, up-to-date antivirus program. A declaration that the application has been developed in compliance with the ICH granulatory document. So the ICH document which is provided, and along with that document only, keeping in mind the application has been developed. Then what is the content which is there in a CD or DVD? So the description of that content, that is of the CD and DVDs, that should be provided. Okay, so now the risk management plan, it contains the safety specification, that is it contains the information about the important identified risk, important potential risk, and the important missing information. Okay, so now this information, it is divided into two parts, that is the pharmacovigilance activities and risk minimization activities. So pharmacovigilance activities, as we have already discussed, that it is a plan for activities for collecting the information related to the individual risk, and they are also divided into two, that is routine and additional pharmacovigilance activities. So routine activities are collecting information on adverse drug reaction, and additional information like collecting information on early post-marketing phase vigilance, EPPV, and post-marketing surveillance or post-marketing clinical studies. Then risk minimization activities, which are the plans for the safety measures which are taken to minimize the risk. And these are also divided into two, that is routine and additional. So routine activities are the electronic package inserts and the drug guide for the patients. And additional activities are the information provisions for the early post-marketing farm phase vigilance, and what are the safety measures which are taken for proper use and for setting of the terms of use. So all that information is provided in the risk management plan. Okay, understood? Is it clear? Now this is the RMP cycle. So the first step in this RMP cycle is it starts from here. Plan risk characterization and minimization and benefit maximization. So now you have to plan certain activities. What the marketing authorization holder do, they plan the risk, they characterize the risk first of all, then they plan for how they can minimize the risk and how they can maximize the risk. And after that, when they have planned those activities, so according to that only the activities are planned, and then after that those activities are implemented. Okay, so risk characterization and benefit maximization, all these activities are implemented. Then after that, the effectiveness of these risk minimization activities are monitored, and new data related to this is collected. Then after that, again, after that, the risk quantification and benefit assessment is done. Now, from the information which is collected and which is collected by monitoring the effectiveness of the risk minimization activities, risk quantification and benefit assessment is done. Okay, risk is quantified, that what is a risk, whether it is serious, whether it is non-serious, whether it is whether it is frequent or non-frequent, and the benefit assessment is done. And then on the basis of the information which is available, risk benefit balance is evaluated. Now if after evaluating the risk benefit balance, now certain risk which can be deleted from the risk management plan, or some new risk will be added in the risk management plan, and to the success of the risk minimization activities is also evaluated. And then on the basis of that, again, for the subsequent year. Again, the risk characterization and minimization and the benefit maximization plans or the additional risk minimization activities are planned. And again, so like this, the whole cycle goes on. Okay, understood? So now in case when the RMP is submitted and now the RMP needs to be revised, so what are the information which can be updated? So first, the important identified risk. So there are certain risks which are identified, which are already identified that these are the risks. So now from these, so related to these identified risks, there is no further evaluation is required in the PV plan. So from the PV plan or from the PV activities, pharmacovigilance activities, there is no information which is available relevant to that identified risk. So then narrow down the process deviation with control over risk, or in case we know that this risk is associated with the use of the drug, but now this risk can be subsided or this risk by introducing any new medication along with this combination. Suppose, for example, it is known that with antibiotics, it leads to acidity or acid reflux. So that along with that, the doctors can prescribe you with an antacid, which in this case, that will not happen. So now we have a control over that risk. Okay. So in that case, that risk will then removed from the RMP. Okay. Then in the second case is the important potential risk. So now these risks, some certain risks are potential, but they are not confirmed that yet that they are associated with the drug, or there is no information or evidence available that this risk is not associated or not confirmed. So in that case, so there is a study which is conducted by the pharmacovigilance professionals for on those or the work is done on those when the new signals are detected. So the work is done on those important potential risks. So the causal association is, so from those important potential risks, if the causal association is confirmed that this risk is associated with the use of the drug, then again that risk will go in the category of important identified risk, and hence the the risk management plans needs to be updated. And when there is no causal association is confirmed that this risk is associated with the use of the drug or not, then that information is removed from RMP. Then after that, missing information. So any information which is available, like if any information is missing information or for which you do not have any relevant data. So when sufficient new information is available and it is confirmed that this risk is not associated with the use of the drug or it is not so serious, then it will be removed for RMP. Or if for that missing information from previous like from the PV activities, it is not characterized further or no information is still available related to that missing information, then that missing information can be removed or that risk can be removed from the RMP. So now in these cases, the RMP needs to be updated and it needs to again submitted to the regulatory authorities. Okay.